I'm Nia Wong in the 4 News Now newsroom, your coronavirus headquarters. And this is what we know on April 21st, 2020. Washington Governor G.O.V./INSLEE laid out his recovery plan for the state today.
I'd like to talk with you about what the process of lifting COVID-19 restrictions will look like. And it will look more like a turning of a dial than the flip of a switch. We're going to take steps and then monitor to see whether they work or if we must continue to adapt. We will not be able to lift many of the restrictions by May 4th. And we will let you know when we can lift those restrictions just as soon as we know. Washington's likely decline in the spread of COVID-19 is encouraging. In the coming days, we will receive additional health modeling projecting the course of this virus. And we hope it will give us cause to begin lifting certain restrictions. Now, because of the great work in our hospital system, for instance, we believe we can soon allow some elective surgeries to resume, provided health professionals have appropriate personal protective equipment. We also hope we can begin to let people take part in more outdoor recreation that is so much part of our identity as well as our physical and mental health. And because of the collaborative work my office has been able to do with the construction industry and labor unions, we have come up with a sensible plan for allowing limited return to construction with safety measures in place. Now, we hope that the data comes in the next few days so we can implement these measures. Now, we can modify some of these restrictions in the coming weeks if the health modeling holds up. The health of Washingtonians is our top priority. We need healthy people in order to build a healthy economy. The data tells us that if we were to lift all restrictions right now, or even 2 weeks from now, this decline would almost certainly stop, and the spread of COVID-19 would go up. Our gains in this fight have been hard-won thanks to the sacrifices of countless Washingtonians. And to turn back on this successful temporary approach now would be disastrous. So this recovery requires a strategic approach guided by science, not politics. And it does not differ greatly from the recovery plans of other Western states. It does not differ greatly from the principles of the White House's National Recovery Outline either. Our recovery begins with widely available testing for individuals who may have COVID-19, tracing with whom they have had contact, and having individuals isolate or quarantine if they could be transmitters of the virus. Now, between our state and local health jurisdictions, we expect roughly 1,500 workers focused solely on contact tracing by the second week of May. This workforce will be a rapid response team.
Meanwhile, there are 2 new deaths in Spokane County, bringing the total to 19. There are 315 cases, 2 more than yesterday. The number of people in the hospital from COVID-19 dropped from 15 yesterday to 12 today. In the Idaho Panhandle, there are now 58 cases, 2 more than yesterday, and no deaths. The Spokane Regional Health Department is growing concern over people's mental health. Today, Dr. Bob Letts offered these tips to help ease the stress.
Just a little stress reliever. Set up a routine. If you haven't established a routine, I strongly encourage you to do so. It's really key that you know that you're going to be doing this and that. It just really helps to get you through the day. Get out. Be physically active. Physical activity, exercise, as good as medications for mild and moderate stress. So be active. And if you see somebody, wave. That social connection is really important. Make eye contact, wave. How are you across the street? As I mentioned, I think the other day, it was really rewarding to see neighbors on Sunday, all physically distancing, walking their dogs, 8 or 10 people walking down the street. That's what you need to do to, again, alleviate some of the stressors that we're dealing with right now.
That stress can lead to domestic violence. If you or someone you know needs help, call the YWCA 24-hour helpline at 509-326-2255. The regional helpline is up and running, and that number is 509-625-6650. If you need help paying your utility bills, more than $143,000 has been raised to help. Just call 456-SNAP. From the 4 News Now newsroom, I'm Nia Wong, and that's what we know on April 21st, 2020.